Thanks for tuning into our podcast. We love having you here, and it's our mission to bring you all the latest and greatest tips, skills, and know-how to make you the best that you can be. We know that you have it in you, and we're going to show you how. Now, let's get started. TBI Talk, where you listen.
Hello, and welcome to TBI Talk Podcast. This is a new format I'm trying for TBI Talk to go over, multiple different things, such as TBI recovery, different methods of TBI recovery, rather. How to work through challenges that you may go through, and we're, going to do a collaborative effort on multiple, accounts of people and their struggles. So not only mine, as you may have already known, I got a TBI. My name's Ryan, first of all. I got a TBI back in 2012 when I was hit by an SUV. But if you want to find out more information on that, just click on Ryan's TBI or Ryan's near-death experience. And today we're going to be discussing brain damage, traumatic brain injury causes. And also we're going to be going over recovery from a moderate to severe traumatic brain injury. So, to start off, a brain injury is any injury to the brain that affects a person physically, emotionally, and behaviorally. Brain injuries can happen at birth or may arise later from trauma or an illness. Depending on the cause, a brain injury is called either traumatic or non-traumatic. Traumatic brain injury causes. Traumatic brain injuries do not always include an open head wound or skull fracture. Loss of consciousness may not occur either. These are the most common causes of a traumatic brain injury, TBI. Motor vehicle accidents, falls, violence or gunshot wound, military attack or bomb blast. Here are some examples of non-traumatic brain injury causes. A non-traumatic brain injury may also be called an acquired brain injury, or ABI. This type of brain injury is a result of an illness or condition within the body, and it is not a result of a blow to the head. These are the most common causes of non-traumatic brain injury. Stroke is the leading cause, lack of oxygen, tumors, other illnesses such as cancer, brain infections or inflammation, other infections. Now here are some of the symptoms of traumatic brain injury, or any other type of brain injury. Signs of brain trauma can vary. You may experience physical symptoms or functional and emotional changes if a traumatic or non-traumatic brain injury has occurred. Typically, brain injury causes headache, difficulty coordinating, balance, vision problems, seizures, changes in sensory perception, trouble speaking and swallowing, personality changes, difficulty forming sentences or choosing vocabulary, confusion, trouble communicating, difficulty with reason, focus, and logic, memory impairments. If you are experiencing any of these signs of brain trauma, contact your doctor immediately. So those are, that's pretty much the synopsis based on, to generalize brain injury, which is such a complex subject. So, So let's go ahead with the recovery from a moderate or severe TBI. Some of the health problems that result from a moderate or severe TBI may be prevented or lessened. Getting help with these lifelong issues, also known as chronic disease management, is crucial for improving the lives of persons living with a TBI. How well a person recovers from a severe or moderate traumatic brain injury depends on the multiple factors, such as the health of the person before the injury. So, just to go off, track here, the health of someone with the traumatic brain injury, or the health of a person before the injury. That could be, someone, involved in sports, active lifestyle. That's, if there has to be a person that is best to get a brain injury, it's a healthy person, active person, someone who works out maybe, rather than someone who just doesn't really live an active lifestyle. So to go back, the type and severity of the TBI, that varies very much so on your recovery. And access to healthcare and specialized TBI care. Definitely do your research with TBI as far as TBI care. It is important, as you may, know or guess, and it could mean a lot of different things. So, family and social support. It's very, with my experience with the TBI, getting a TBI and living with the TBI, my family is very supportive of me and works well to, further the healing of my TBI and, the time throughout the hospital, when I was in the hospital. They were with me by my side every day, and I was never alone, away from my family, meaning, and, that really put stress, or not as much stress, but it showed the therapists, the doctors, the nurses that, I'm serious about getting my family and I are serious about getting the proper care that I deserve for my injury. So, healthcare providers can connect to specialized TBI care. A person with a moderate or severe TBI may need specialized medical care, such as rehabilitation after their injury. This may include getting help with relearning skills. Example, walking, speaking, and driving. A healthcare provider can help find and connect people with these services for their community. In their community. A healthcare provider may also screen for and treat problems such as depression, encourage lifestyles that promote brain health, educate patients and their families to prevent and reduce problems that may show up after injury. Rehabilitation seeks to improve the lives of people living with TBI. The goal of TBI rehabilitation is to improve the overall quality of life for persons living with TBI and lower the chance of a TBI-related disability. Rehabilitation programs and services may need help with those living with TBI, improving their ability to do daily tasks independently, not to have to rely on anybody to assist them in any activities, engage with friends and family, and participate in their community activities. Off basis. TBI, when someone has a TBI, it's important to get them integrated into a community, supportive community, may that be family, supportive family, or, friends and, loved ones around you. Stay connected with others during recovery. There are many people who can help you if you or someone you know has experience of moderate or severe TBI. You do not have to do it alone. Examples of some groups that offer support for people living with TBI, their family and loved ones, include the Brain Injury Association of America, United Brain Injury Alliance, and Military Health Systems Traumatic Brain Injury Center of Excellence. So, yeah, that wraps up the first episode of TBITalk Podcast. And once again, thank you for listening. And this is the start of something that will be great. And, lots more information coming your way. TBI Talk, where your brain gets better. Thanks a lot. TBI Talk Podcast. Hello and welcome. Ryan here from TBI Talk. Now, today we're going to go over different ways of progressing your healing for traumatic brain injury. Specifically, we're going to focus on TBI Talk and what content is on the website and go from there. I am going to, read some of the articles that I think is going to be productive for this podcast in particular, and the purpose of it in particular. So let's start off with mood swings with traumatic brain injury, TBI. Now, after a patient suffers a head injury or a traumatic brain injury from a car accident or some other kind of trauma, they may experience rapid changes in their behavior, known commonly as mood swings. Many patients experience these emotions in intense, short instances, often only lasting for a short period of time. Other patients may also experience mood swings. However, the emotional change stays with them for larger amounts of time. Now, most of the time, this is described by people who have a TBI as being an emotional roller coaster, as they switch between feelings and thoughts. Happy thoughts and then anger, all within a short period of time. Mood swings are common to people often after incurring a TBI, as head injuries often damage the part of the brain that is primarily responsible for controlling and governing the different emotions of one's behavior. If this area is altered or damaged due to an injury to the brain, it is easy to know that someone's behavior might suffer a change. People with traumatic brain injuries often have unpredictable behavior. That answers a lot of questions for many, I'm sure. For example, someone with a TBI may experience random periods of crying or laughing. The relating emotions in the areas of the brain that control these responses are damaged. Patients who experience mood swings after a severe head injury often expect to recede over time. As the brain heals, the affected areas of the brain will return to normal. In most cases. I say that very hesitantly. If the problem remains the same, doctors have often prescribed mood stabilizers and other psychotropic medications to help. So that's, the first period of the TBITalk podcast, number 2, the second podcast of TBITalk. So now we're going to switch to not as much different topic, but more different angle of recovery. And, first of all, in order to properly recover from a traumatic brain injury, you have to know some important facts about a traumatic brain injury. So right now, right here, we're just going to go over them very quickly, but not, rush. If you understand what I mean, great. If you don't, I'm sorry to hear that. So, most people after suffering a TBI make a good recovery in most terms. Wearing a seatbelt and wearing a helmet is one of the best ways to help prevent a TBI from ever occurring. One of the most commonly injured areas of the brain is the frontal lobe, which controls thinking and motion regulation. Males are twice as likely to incur a TBI than females are, according to statistics. Wow, that's I gotta swallow that. That's a big number, more than half. So, all right. This post's intention was not to present unfortunate facts about TBIs. Below are some of the best ways to further your healing from TBI. Again, to point the reason for and the topic for today's podcast, TBITalk Podcast. So, all right, let's start with it. There are groups with resources to help TBI survivors and caregivers. So, community is very much needed with this injury, and you can't look past it. It's super important and vital to someone who's either caring for someone with a TBI or someone who has a TBI. So, practice going to occupational, speech, and physical therapy regularly. So it's all about, getting in a habit of something good, productive to your brain to really focus on areas of your personality that you want to improve relating to your functional abilities that were taken away from you after the injury. This helps improve how your mind functions. Since it has been proven that the brain is neuroplastic, therapy only helps accelerate your healing. Neuroplastic, so if you don't know what that means, it means that, to sum it up, to put it in short, it shows that by practicing something over and over again, your brain finds different areas of the brain to connect so that you're able to function, even though an area of the brain was severely damaged in an injury, for example, a brain injury, for example. Now, this is good and everything, but beware of overstimulation. Overstimulation to the brain or body could leave a detrimental effect to you. It is important to someone who has a TBI to regulate their energy as best as they can. A sufficient amount of sleep is paramount in one's recovery. Yes, sleep. As a TBI survivor myself, sleep is very important in my life. I do tend to get tired easier than I used to pre-TBI, and it really it takes more energy for me to do things, even though after I practice doing them so many times, it takes more energy for me to be able to do things as it once did pre-TBI, as I was saying. So sleep is great to say generally. It's especially in this 21st century, it is looked past as not an important part of someone's life, but sleep very much is, and there is a reason that we sleep. So it is a big thing to think about. So definitely make time to sleep, a sufficient amount of time to sleep in one's day. So, all right, now let's see what else we have here that I want to go over today. All right. Walking is very good. Nice way to end the day. A nice afternoon or nighttime walk. Just allows you to think properly, clears your mind. Just gives you that time to relax after a busy day, even just a regular kind of day. It gives your brain, your mind, your soul a chance to relax and unwind and make sense of things, because so many things in this world today do not make sense. They seem not to make sense. So it is always great to have that time of reflection on your day. And that's about it. I don't want to keep talking because I want to spread the episodes apart, the podcast apart. So, I want nice content to go into every podcast. So, on that note, I hope you have a great rest of your day. And again, visit our website, TBITalk.com. That's TBITalk.com. TBITalk.com. And have a great day. This is Ryan on TBI Talk, where your brain gets better. Thanks a lot.